Hello everyone, my name is Surya, registered nurse. Welcome to another session of Nurse Talk. Today we are going to discuss about another neurological condition. Its name is Gullian Barre syndrome. So we already had a small discussion about multiple sclerosis the other day. And when I was talking about multiple sclerosis, I already said you that multiple sclerosis is occurring because of demyelination in central nervous system. Sorry, that is the destruction of myelin sheath in central nervous system, and this is multiple sclerosis. In today's topic we are going to discuss Guillain-Barre syndrome, and in this disorder what happening is it is a destruction of myelin sheath itself in peripheral nervous system is Guillain-Barre syndrome. So if the destruction of the myelin sheath on top of the neurons is occurring in the peripheral nervous system, that disease condition is known as Guillain-Barre syndrome. So I hope you got the difference between multiple sclerosis and Guillain-Barre syndrome. So it's a rare autoimmune disorder causing nerve damage and muscle weakness. Of course, the muscle weakness will be there because the myelin sheath here is affected in the PNS, peripheral nervous system. So the muscle weakness will be there and the lack of reflexes will be there for the person if the person has a diagnosis of Guillain-Barre syndrome. So how is it happening? What is the cause? So we already said its pathophysiology is the immune system. It is an autoimmune disorder. That means our own body attacking our own cells. Our own immunity is affected in that case. So it's an autoimmune disorder where our own immune system attacks the peripheral nerves, resulting in demyelination. So the myelin sheath is destructed here because of the immune system attacking to our own body. That's an autoimmune disorder. So this is a very important point in here. It's a risk factor. So what are the risk factors for Guillain-Barre syndrome? Here it says surgery, COVID, and infection. So one of the favorite questions for the multiple choice questionnaires in our nursing syllabus examination is this one in here, Campylobacter. It's a causative organism of Guillain-Barre syndrome. So in 90% of the cases, Guillain-Barre syndrome is caused after the infection of Campylobacter jejuni. So in a question, if they ask like, what among the following is a causative organism of Guillain-Barre syndrome? Or that is answer is Campylobacter jejuni. Or otherwise, in case if they ask, if a patient got admitted to your ward with a chronic gastritis, yeah, after examining the patient was found that the patient have got neurological disorder. What that neurological disorder may be, that can be also, if the option is there, it is maybe Guillain-Barre syndrome. Because Campylobacter jejuni cause gastritis. So in 90% of the cases, the Guillain-Barre syndrome is caused by Campylobacter jejuni. So this question has been asked a couple of times before. That's why I'm saying it again and again. Campylobacter jejuni is a causative organism of Guillain-Barre syndrome. It's an autoimmune disorder. There can be other causative things like cytomegalovirus or herpes simplex virus or viral infections that can also cause Guillain-Barre syndrome. But this is the most important cases in most of the cases, 90% of the cases. Yes, 90% of the cases of Guillain-Barre syndrome are affected by Campylobacter jejuni. Very, very, very important point. And coming to the symptoms, what are the symptoms for a patient who is having a neurological disorder? We have already discussed about a couple of neurological disorders like multiple sclerosis. So we already know what will happen for the patient. The patient will be having weakness. And I'm just leaving this for now. Areflexia and respiratory muscle weakness. So the patient obviously will be having weakness because the myelin sheath is not working properly or it is totally destructed. The signals or the reflexes are not moving as fast as before for the patient because of the destruction of the myelin sheath in the peripheral nervous system. So the patient will obviously have weakness and areflexia, that the patient will lack reflexes. And here comes ascending paralysis. Ascending paralysis. Okay, so if I ask you to count in an ascending order, how will you count? 1, 2, 3, 4. This is ascending. That means from the lowest to the highest. So the person will be having a paralysis from the toes first, then to the leg, thigh, abdomen, chest. Okay, this is ascending paralysis. So the sorry, this is becoming this ascending from here to here. First type of paralysis will be on the toe of the patient, and then it will go up like this. So this is ascending paralysis. So the patient will be having difficulty in walking or difficulty in moving first, and then that paralysis will go up straight, and the patient will end up in respiratory muscle weakness, because this muscle weakness is coming up from the legs, and obviously it is going to reach our chest. So that time the patient will be having respiratory muscle weakness, respiratory distress, difficulty in breathing. So all these things will accompany the ascending paralysis. And other than this, it's not mentioned here. There is a classic triad for Gullian Barre syndrome, and that is ophthalmoplegia, areflexia, and ataxia. Okay, ophthalmoplegia, areflexia, and ataxia. So we already discussed about plegia. What is plegia? Plegia is like we have heard about quadriplegia, paraplegia, hemiplegia. That is paralysis. Yes, plegia is a term which is used to describe paralysis. Ophthalmoplegia means the patient will be having difficulty in the movement of eye. Yes, ophthalmo means movement of eye is affected in this case. So the patient is having a classic triad of ophthalmoplegia, areflexia, we already said that, lack of reflexes, and ataxia, so lack of muscle coordination. Muscle coordination, the patient will be having difficulty in moving, coordinating their voluntary muscles to make their movements. This is also seen in multiple sclerosis as well. So these are the classic triad of Guillain-Barré syndrome: ophthalmoplegia, areflexia, ataxia. You have to learn it by heart. And in this ophthalmoplegia, when we were discussing about cranial nerves, if you remember, I was saying a particular cranial nerve is used for the eye movements. Do you remember? What were the cranial nerves we were discussing? Oculomotor, optic, olfactory, yeah. in the order, the third cranial nerve is oculomotor. The third cranial nerve is oculomotor. So oculomotor cranial nerve 3. Oculomotor cranial nerve is the cranial nerve responsible for the movement of eye. So in Guillain-Barré syndrome, the patient is not able to move the eyes, like it is like ophthalmoplegia. The patient is having difficulty in the movement of eye. So in this Guillain-Barré syndrome, so which cranial nerve is affected? Very easy. The cranial nerve 3 is affected. Cranial nerve 3, that is oculomotor cranial nerve, is affected. So in case, if they ask, we already studied about Guillain-Barré syndrome before the exam. Like imagine we have studied everything about Guillain-Barré syndrome. It's an autoimmune disorder. What's happening is peripheral nervous system is affected. Schwann cells, like the myelin sheath, is affected in the peripheral nervous system, and the result in the patient's weakness and lack of muscle tone, and can also be caused by Campylobacter jejuni bacteria in most of the cases. Classic triad is ophthalmoplegia, areflexia, ataxia. We have learned everything, but the question comes up like, in Guillain-Barré syndrome, which cranial nerve is affected? Imagine if a question comes up like that, what will you answer? We already know every single detail about Guillain-Barré syndrome, but the question asked is which cranial nerve is affected. It's very easy to understand if you learn it. It's very easy to remember that since the patient is having an ophthalmoplegia, that means the movement of eye is affected. The cranial nerve 3 is here affected. That's oculomotor. Olfactory, optic, oculomotor. Oculomotor is the third cranial nerve. We have already mentioned about the cranial nerves in detail. In that, I have mentioned that oculomotor is the third cranial nerve which will help in the movement of our eyes. So if the patient is having an ophthalmoplegia, cranial nerve 3 is affected. So in case if they ask, what is a classic triad of Guillain-Barré syndrome? You know, it is ophthalmoplegia, areflexia, ataxia. And in case if they ask, which cranial nerve is affected in the Guillain-Barré syndrome? It is cranial nerve 3. And what is a causative organism in most of the cases of Guillain-Barré syndrome? That is Campylobacter jejuni, which causes gastritis for a patient and can result, it can be a risk factor for Guillain-Barré syndrome. And in case another question also, what is affected in the Guillain-Barré syndrome? So myelin sheath in the peripheral nervous system is affected in Guillain-Barré syndrome. So how will we diagnose if a patient is coming to us with neurological symptoms and the patient is having weakness, ascending weakness, very, 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 very important. I'm saying ascending weakness again and again because there is another disease condition with the descending weakness. So remember, GA, Guillain-Barre syndrome, is for ascending weakness. Ascending means from down to above, like from bottom to above. So that is from the legs to head. Okay, here is the legs, here is the head. So this is ascending weakness. The patient will be having weakness first on the toes and legs, and then it will go upright like that. Okay, the patient will also end up in respiratory distress or respiratory muscle weakness, not proper functioning of the diaphragm because the patient has got Guillain-Barre syndrome. So this is ascending weakness is seen in the Guillain-Barre syndrome. So how are we going to diagnose this? The diagnosis is a neurological examination. First one, clinical examination to understand what are the symptoms of the patient, and then CSF. In the CSF analysis, we can see elevated protein, okay, and also nerve conduction studies. There are two studies we will do for understanding Guillain-Barre syndrome: nerve conduction study and electromyography. Nerve conduction study, it's here, nerve conduction study and electromyography. Myo means what? Myo is a term which shows muscles. Okay, in electromyography, a needle electrode is inserted into the muscle of the patient, and the neurologist will ask you to contract the muscle, contract the rest muscle. So, needle electrode will be inserted inside your muscle, and then they will ask you to contract the muscle, and then they will assess the muscle strength. That is in order to understand if there is any weakness in the muscle, because Guillain-Barre syndrome is always manifested with the weakness. So that is electromyography. So myo means muscles, just remember that. Next one is nerve conduction study. Nerve conduction study, the nerves are stimulating electrode. One stimulating electrode is placed over the nerves and the shock is applied. And we will see how fast the impulses are moving. Why? Because myelin sheath is the structure in the nerve which helps in the faster movement of signals. We have already discussed in detail about the myelin sheath in the multiple sclerosis. So in multiple sclerosis, I was saying that the myelin sheath is affected. The nerves are not going to pass fast because the myelin sheath, the function of myelin sheath is to get the impulses provide faster movement for the impulses. So if the myelin sheath is affected, the impulses are not going to move fast. So in Guillain-Barre syndrome, the same thing is happening. Here is a neuron, cell body, and here is an axon, and here is the dendrites. Okay, this axon is covered by myelin sheath like that. There's a myelin sheath here, and this myelin sheath will help in the faster movement of impulses from the cell body to the dendrites. Okay, this helps in the faster movement. Faster. This is faster in here because the myelin sheath are proper. Imagine if the myelin sheath are affected in here. See, myelin sheath is got destructed in here. Okay, so in here the signals will be moving very, very slow, very slow. So in nerve conduction study, we are going to provide an electrode on the nerve and we are going to stimulate the nerve and see how faster the signals are moving. If the signals are moving very, very slow, that means the myelin sheath is affected in here and the patient has a diagnosis of Guillain-Barre syndrome. If the signals are moving as fast as they were going before, it is normal for a patient. Or the patient will be having a different diagnosis other than Guillain-Barre syndrome because the patient is in the hospital. Okay, so this is how nerve conduction study works. And how are we going to treat the patient? Treatment is plasmapheresis. Plasmapheresis means it is the infusion of the plasma infusion. IV immunoglobulin. Here it says IV immunoglobulin. IG means IV immunoglobulin because this is an autoimmune disorder. So we will obviously provide IV immunoglobulin for the patient. And the next one is plasmapheresis. Plasmapheresis is the plasma infusion. Plasmapheresis. So this is plasmapheresis is a treatment used in multiple sclerosis also because of the patient is having an autoimmune disorder. If the patient got an autoimmune disorder, we can do a plasma infusion for the patient. So I hope you got an idea about Guillain-Barre syndrome here. So what is it? Guillain-Barre syndrome is a disease condition. It's an autoimmune disorder causing nerve damage and muscle weakness. The pathophysiology is immune system is getting attacked, like the myelin sheath in the peripheral nervous system is got destructed, and that's affecting the weakness, the muscle weakness of the patient. And then the risk factors can be very, 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 very important. Campylobacter jejuni, 90% cause of the Guillain-Barre syndrome is Campylobacter jejuni. And then cytomegalovirus or surgery or COVID-19 can also cause, because it's an autoimmune disorder. The body is making immunity against ourselves. So that is going to cause destruction of myelin sheath and then thereby Guillain-Barre syndrome. And the symptoms, first and foremost thing is ascending weakness. Ascending paralysis, okay, very, very important. The patient is going to have muscle weakness, areflexia, lack of reflexes, and then I said about the classic triad: ophthalmoplegia, areflexia, ataxia. In ophthalmoplegia, cranial nerve 3, oculomotor cranial nerve is affected in the ophthalmoplegia, and then this can be diagnosed by having clinical examination or CSF analysis. Increased protein will be seen in the CSF, and nerve conduction study and electromyography. Treatment is IV immunoglobulin or plasmapheresis for the patient, and nursing management like the supportive care. So in the supportive care, coming to the nursing management of the person, what is a major supportive care we are going to provide for the patient? Okay. So this is another question. Whenever you get a question in any MCQ, state government or central government or set RRB, whatever the exam is, when you get a question about prioritizing the nursing management for a patient, always go with A, B, C, D. First one is airway, then breathing, circulation, and disability. So if you get a question about a patient who is having a whatever the disease condition is, whatever the disease condition is, if the question says the patient is having difficulty in breathing, or the patient is having an obstruction in airway, for example, the patient having a seizure, so obviously the airway is obstructed because of the secretions. So otherwise the patient is having is not able to speak. That means the patient has something obstructed in the throat, or the patient is having a weird sound of breathing, like the patient's breathing doesn't sound properly. In all those cases, go with the priority A, B, C, D, E. Always the patient's airway is the first management in the nursing management. First thing is airway. Make sure the patient's airway is clear. That is the first answer for every disease condition. So in Guillain-Barre syndrome, when we are talking about supportive care, the patient obviously have respiratory muscle weakness, and hence the patient is having breathing difficulty. So first one is airway management, or managing the breathing difficulty of the patient. So obviously, if the patient is having breathing difficulty, first one is airway management or breathing, and then if the patient is going for a respiratory paralysis, intubation, mechanical ventilation, tracheostomy, all these things can be provided in the nursing management um, as per the doctor's order. So obviously, whenever you get it, because I have seen such questions, prioritizing the nursing care. So whenever you get a diagnosis of the patient, read the question properly and see if there is any clue for an airway obstruction in there. If there is an airway obstruction, that is the answer, because the patient needs the airway cleared first, and then we'll go for breathing, and then we'll go for circulation and disability. So airway is the first and foremost thing to remember if you are getting a question to prioritize the nursing care in an examination. Okay, I hope you got some questions from this topic about the Guillain-Barre syndrome, and also what is the cranial nerve involved in the Guillain-Barre syndrome, and what is the classic triad of Guillain-Barre syndrome, and what is the management of Guillain-Barre syndrome. Yes, I hope you got an idea about that. Thanks for watching the video and keep supporting me. Thank you very much. Bye bye.